Welcome to the podcast for healing neurology, where we talk about everything that can help heal your neurology, which is really everything from food, lifestyle, and medicine to nature, culture, and politics. There's no topic too big or too small. I'm Jillian Ehrlich, family nurse practitioner, certified in Ayurveda and functional medicine. And we have a really special guest today, Dr. Shae Datta. She is a sports neurotrauma and headache specialist neurologist with one purpose in mind: to help people heal from impact of brain disorders. As a physician wellness ambassador, Dr. Datta empowers healthcare professionals to tackle burnout through shifting conversations in medicine based on evidence-based research. As a first-generation South Asian American who experienced her own burnout during residency, she's focused on helping physicians reclaim the balance, purpose, and passion in their lives. She was the 2019 American College of Graduate Medical Education, ACGME, Back to Bedside Proposal honoree, and led the first resident delegation to the ACGME national meeting to propose burnout alleviation through technology-led patient engagement tools. She draws on her clinical and personal experience to deliver workshops on stress management and other burnout prevention tools in medical school and residency programs. Dr. Datta learned the application of Ayurvedic and homeopathic and natural healing in India. Importantly, for modern healthcare, she is adept at bridging the gap between allopathic and integrative medicine to offer a more holistic approach to health and healing. And since entering medical school, she's pursued an integrative and wellness approach to medicine in order to offer patients informed treatments and mind-body healing protocols that will guide them towards optimal health. Dr. Datta did her neurology residency at Hackensack University in New Jersey. She was the inaugural Sports NeuroTrauma Fellow at the University of Florida under the tutelage of renowned concussion and brain injury experts. Dr. Datta is currently the Director of Concussion and Neuro-Cognition at New York University Langone. She is an associate professor in the Department of Neurology and at the NYU Long Island School of Medicine and the Physician Wellness Committee. She is the current elected vice chair of the American Academy of Neurology's Sports NeuroTrauma section. She's presented at several national society meetings and gotten numerous awards for her research in brain trauma, including the ACGME, Southern Headache Society, American Headache Society, Sports Neurology Conference, Learn Skin Microbiome Summit, and European Neurocritical Care Society. Her research interests include the gut-brain axis and the brain glymphatics network, and you can find her at NYU Langone on Long Island. Whew, God, you are cool. This is going to be great. So welcome. We're really, really happy to have you.
Thank you so much. That is quite a mouthful. And sometimes it doesn't even seem like I've done all those things, but I'm actually very excited to be here because we have some similar things that we're interested in terms of helping patients.
Yeah, absolutely. Absolutely. And we see a lot of TBI or traumatic brain injury in our practice. And we talk about how sometimes brain injuries are physical, like you bump your head, you fall or get hit by a car, whatever it is. And then sometimes we've got metabolic TBIs. So there's lots of ways that your brain can get injured. And as we're starting this, could we start with kind of talking a little bit, just briefly, about the anatomy and physiology? Like, where are we in the body when we talk about brain injuries? What does that really mean? We know we have a sense of like what the brain is, but could you tell us like what's in there and what's related when we talk about traumatic brain injury?
Sure. Actually, that's a great jumping off point, right? Everyone always hears about the brain, the spinal cord, and the CNS, PNS. So let's start with the central nervous system, which is called the CNS, right? It's actually composed of the brain, which is basically the command center of the whole body, and then the spinal cord, which is this is the central part, right? It also contains relay neurons, which are interneurons in between itself, because this is the way that we communicate from the CNS, let's say, even to the PNS, which is the peripheral nervous system. It's composed of cranial nerves, spinal nerves. So cranial nerves are actually inside the cranium or in the brain, spinal nerves in the spine, and peripheral nerves that go from the spinal cord to our extremities or our organs to help us feel pain or give some type of signal that, something needs to be done now, okay? Or senses danger or releases certain neurotransmitters in order for a certain execution of an activity or thing to actually happen, okay? So within the peripheral nervous system, we have sensory neurons and then we have motor. Sensory, just like what it sounds like, it's like gives us all our senses. Motor is what is for our active moving, right? Our arms, of our tongue, our muscles, and that's what motor neurons do. So that's a gross oversimplification. And when we're talking about more the nerves in the CNS that are related or more active if we think about traumatic brain injury. I'll get to that in a second as well. Well, let's talk about one type of cell, the glial cell, right? It's called microglia. They're located all throughout the brain and spinal cord. They're about 10 to 15% of all cells found inside the brain. And basically, they are macrophages, because macrophages, what they do they are basically like scavengers of waste and try to clear away the things that don't belong somewhere. They act as first and main form of active immune defense in the CNS. And we want to keep in mind the immune system when we're talking about traumatic brain injury, and we'll get to why in a second as well. Then we have astrocytes. They're the most numerous cell type in the CNS, and they perform a variety of tasks, right? They guide the axons, meaning like the nerve terminals and the body of the nerves, and the synapses, where there's like the neurotransmitters that get secreted to control the blood-brain barrier and blood flow within the blood, within the brain.
All right, so that's where we are. That's kind of locating us in the body. Okay, so what happens, like what's the anatomy and the physiology? What's going on when we have a traumatic brain injury? What's happening in there?
Right, so there is something, so basically I just want to clarify, right? There's TBI and then there's mTBI. mTBI is mild traumatic brain injury, and then there's traumatic brain injury, but sometimes they're interchangeable. Basically, mTBI, when you have a mild injury, these are the ones that are called concussion, right? What happens is after you may get a head hit or your brain or spinal cord either struck by something or your body strikes something. And most of the time you lose consciousness for less than 30 seconds to 1 minute with a mild traumatic brain injury. And with a traumatic brain injury, you will have prolonged loss of consciousness and even structural bleed within the brain. And it basically occurs when there's a sudden trauma or head injury disrupting the function of the brain. And most of the time you'll get checked out. Let's say if your symptoms are severe enough and they feel that your exam warrants it in the ER, they will do a CAT scan or maybe they'll do an MRI or they'll do a CT of the neck, right? If you've been involved in a motor vehicle accident. And most of the time, about 90% of the time, they're normal, right? But at the same time, even though that's normal, within a day or right away, people are having trouble with memory and reasoning. They're having strange sensations of touch, taste, and smell at times. They'll have difficulty with language processing and speaking, aphasia at times, depression, anxiety, personality changes, aggression, social inappropriateness, or they'll just like have odd sort of reactions to things that, they were normally okay watching, like horror movies or really sad movies. And basically there's about 1.7 million in the people in the US who sustain traumatic brain injuries annually. And it's kind of sad, and the causes are like slips and falls, like vehicle collisions, domestic violence, sports injuries, obviously. So basically, we also don't want to forget the military, right? We also have a big military population that gets a lot of traumatic brain injuries. So there's many ways you can get traumatic brain injuries. And just to your point about what a metabolic brain injury could be, that could be also because you have exposure to some kind of chemical over time that's affecting the blood-brain barrier over time and can give you similar symptoms as what we just discussed.
What is happening inside the brain when you have a concussion or a traumatic brain injury? What happens?
Right. So when you first have that hit to the head, and one of the most common is a contre-coup injury, which is French for basically when your brain kind of jiggles, hits the inside of your skull, and then hits the back again. Although there's nothing on the scans, at a cellular level, you have disruption of the sodium, potassium, ATPase pump. That it's sort of like what makes the cell function correctly. Or you can even have microhemorrhages as a result. Like there's like tiny tears in the neurons, almost like a bruise. Like if you bang your arm against something, you'll have a small bruise. But like really, you can feel it and it's uncomfortable and you have the symptoms, but it's not really such a huge injury that's going to cause like a lot of bleeding outwardly. But it's a real bruise, right? You feel it, it's sore. And also on the microscopic level in the brain, the arterial blood supply will get disrupted. You will have tissue metabolism that'll slow down in the injured tissue. You can have change metabolic demand, meaning at that point, your brain needs more glucose, more rest, certain things to support it because the oxygen basically supply or the exchange is not happening at the same level before. Yeah. So, the blood oxygenation system also changes. There's changed blood flow. And as I said, the microhemorrhages sometimes can be picked up on very sensitive MRIs, or even the metabolism of the brain. If we do fMRI, functional MRIs, can be seen that the brain, like glucose metabolism, is different, after an injury.
Can you talk a little bit about the glymphatic system and what that does in relation to TBI?
I love the fact that we now have a name for it, right? So before, there used to be the idea that there's no lymphatic system in the brain. And as you know, in the body, what the lymphatic system does is drain all of our waste, right? So that's the primary way waste is kind of like drained away from our tissues, our organs. And if lymph nodes swell, then most of the time we're a little bit scared, right? Because they're not able to properly drain, the body's overwhelmed. We think about cancer or infection. We try to get to the root cause and we do lymph node biopsies and further tests at that point. We have found out that a similar lymphatic system exists in the brain. It's called the glymphatic system. It's part of what we now have called the gut-brain axis. So before we thought, the brain and the spinal cord is somewhat independent of the body. I mean, we didn't really believe that, but we didn't have any way to prove otherwise. But basically, by now doing studies in rat brains and different models and putting them through like injecting things that will cross the blood-brain barrier and then tracking it through like radio-labeled microbes and stuff, we have seen that it's actually crossing through from the brain into the stomach pretty readily. And especially after an injury, right? So the gut-brain axis at that point gets disrupted. So just to talk briefly about how the gut and the brain are connected, your gut contains about 500 million neurons, which are connected to your brain through nerves in your nervous system. So one of the biggest nerves is called the vagus nerve. It connects your gut and the brain. It sends a signal in both directions. So for example, in animal studies, the stress can inhibit the signals sent through the vagus nerve and also causes GI problems, right? So how many of us, right, we have like a big presentation, or some people have like exam anxiety, or right before like a big meeting or a date, like your stomach starts acting up. Like you'll be like, okay, I won't eat too much right before this big thing because like I have a sensitive stomach, right? This kind of proves to us that, you're cognitively having stress and then your stomach is affected right away. This shows that the vagus nerve is likely very important in the brain-gut axis and its role on stress. Yeah, your gut and brain are also connected through chemicals called neurotransmitters, right? So a neurotransmitter, we all know about serotonin, which is the target of a lot of the antidepressants. It contributes to our feelings of happiness, right? And many of these neurotransmitters are actually produced in your gut by trillions of microbes living there. So when the serotonin is produced in the gut, they also produce something called gamma, which controls our fear response and stress as well. It's a calming chemical or neurotransmitter, which is what anti-anxiety medicines try to mimic.
And so when we have a traumatic brain injury and all of these connections are disrupted, then it sounds like the signaling that could happen before, it's like the roads have changed in the town and you kind of can't get to your destination like you used to. Is that right?
Yeah, we are finding out more and more. Not saying that we have it all figured out, but basically they have done a lot of studies on certain strains of even probiotics that have been given to people over time that actually affects anxiety, will affect mood, will affect impulsiveness, or they found disruptions in the gut-brain bacteria of people with mental illness like bipolar disorder or schizophrenia, showing that there's actually different flora living there. Their gut microbiomes are different than someone who doesn't live with those mood disorders.
That's so interesting. I think they're calling them psychbiotics.
Exactly.
And you can buy them now, like in little bottles, a little bottle of psychbiotics.
Yeah, there's so many out there now. We can talk a little bit about the strains in a minute, but in general, we're we're figuring it and out now that if there's an unhappy gut, there's an unhappy brain. Basically what happens is if you have impaired absorption of important nutrients for your brain health, it can happen if your gut is inflamed, which can then translate to brain inflammation. So a lot of times we're finding out that, anytime that the gut is inflamed, like for instance, people, this will change the cytokine and peptide secretions, which can lead to dysregulation in the brain. So cytokines are inflammatory neurotransmitters, right? That basically we don't want inflammation to be high anywhere in the body. That's where the problems basically start. You can also have reduced serotonin synthesis. This could lead to depression and low moods. Also, inadequate melatonin production from serotonin imbalances can cause insomnia, right? Melatonin actually regulates your circadian rhythm, right? Also, if you have gut bacteria overgrowth, now we're talking about good bacteria, but you have bad bacteria overgrowth after like maybe having, not a balanced diet or not taking too many antibiotics at one time or being on certain prescription meds, so that you can have something called dysbiosis, and that can lead to anxiety and feelings of fear as well.
It's I just want to take a quick pause and say how awesome it is that very quickly you as a neurologist have gone to like the gut, the diet, the digestion. Like, it's just awesome.
Oh, thank you. I mean, I just really feel that a lot of times as neurologists, we give a lot of bad news, but we're not really able to explain things to people.
Yeah.
And I always like to try to empower my patients with as much information about the underlying cause of why something happens.
Yeah.
A lot of times I can't, but we are finding out more about immune signaling and the brain. And that's like the best way for us to kind of empower them to do better with their lifestyle choices.
So what are some of the names of these psychobiotics?
Yeah, so psychobiotics, like you said, they're probiotics and they have potential therapeutic benefits for basically helping our brain-gut connection. So the probiotic strain, one of them that's been studied and proven, we all know L-acidophilus, right? That's like the number one that's always on every yogurt bottle. Basically, this one helps to reduce cholesterol and support nutrient absorption. There's one called B. longum. It may reduce depression and anxiety. It helps people with inflammatory bowel disease as well. The one is called B. bifidum. It helps generate vitamins like vitamin K and B12, which also influence mood. There's B. infantis. It caused increased relaxation in the rat model, but also helps with treating irritable bowel syndrome. As we referenced before, we want to cut down on inflammation in the gut so that it doesn't cross over to the brain. Then there's L. reuteri. It's known to have an anti-pain effect, and it can help increase basically excitability or make you like a little more alert. Plantarum, it significantly increased serotonin and dopamine in mice, and it reduced anxious behavior when they were in a maze. And then last but not least, it's L. helveticus. Rats administered with the L. helveticus showed decline in anxiety scores. So there are some formulations on the market that actually have, a mixture of these. There's a study in Frontiers of Neuroscience that showed people with Alzheimer's who took probiotics, like a mixture of L-acidophilus, KC, bifidum, and fermentum, experienced positive effects on cognitive functions like learning power and memory.
Okay, so cool. Okay, so already we're getting a little into treatment possibilities. If we back up one step, some of your research interest specifically is about kind of the progression of TBI and some of the what we call sequelae, so things that are possible afterwards. What are the different directions that a TBI can kind of progress into? What are we worried about? What happens? What do we want to make sure that we can try and avoid with treatments if we can? And then after this section, we'll go a little bit more into treatments. What can happen from a TBI long term?
Yeah, absolutely. Traumatic brain injury, I find it that no two people are ever the same. Everyone's like a fingerprint or a snowflake, right? One thing we have to always, as clinicians, keep in mind is what was their functional status prior to this happening? Were they a person who used to always get migraines already? Did they have poor diet? Did they have low cognitive reserve? Did they have anxiety disorders already? They have a lot of depression and stress in their life. Did they not sleep already? chances are if there were a lot of issues affecting their brain health already, they are going to have a longer path to recovery. Okay. Mm-hmm. And when they first get a traumatic brain injury, it could be anything from, oh, I'm just having a little more anxiety, to, oh my God, I can't focus, light bothers me, sound bothers me, I'm ringing in my ears, I'm imbalanced, I'm depressed. So it really depends. I've seen people fall off horses and get trampled and get a bleed and have a cranium and come to me for a follow-up, and they're like, yeah, I have mild headaches, but I think I'll be okay, to, oh, they just got, hit, walked into a wall or walked into the top of the basement stairs, and basically they're just so not able to focus despite all the tests coming back.
So one thing we can keep in mind is that they may not be kind of making it up, even if the injury has appeared mild, that they may still have real and severe symptoms.
Oh, absolutely. And it takes someone sort of specially trained to kind of go through. And we actually have the ability to do a lot of in-office testing as well as sideline testing now, further neuropsychological testing to find out the exact domains that people need help in. Mm-hmm. But, for me, luckily enough, I went to a specialty fellowship training where we can basically triage them and see, and it becomes sort of like a gut reaction about how I can best support them in the acute phase and what they might need in order to get them over that hump. Mm-hmm. That might mean a mixture of vitamins, as well as making sure that they are really strict with the lifestyle modifications, like lights out at a certain time, no screen time before going to bed, and actively treating their migraines with a combination of prescriptions, pharmaceuticals as well. And that could be for a short while, or they might just progress to having post-traumatic migraines. Most of the time, that's not the case. Most people recover within 6 months at the.
Let's talk about testing and evaluation. Someone comes to you and says, I have a head injury. What do you do? How do you evaluate them?
Yeah, so hopefully they are in the acute phase, right? They've just had it within the month. It's harder for me when they come to me after they've been basically 10 years out or something. That's tougher, right? Yeah. The sooner they get to you, the better it is. Most of the time they've come through the ER and they've already determined that there's no bleed. We can start there, or no structural disc injury or something. Mm-hmm. So the assessment initially is basically for me to do a full neurologic exam and see where the deficits lie. Are they getting triggered with their symptoms with simple eye movements or balance exercises that we do? We also do a full symptom profile, a concussion severity scale, to see where they rate, to see how severe their symptoms are. And using that as a benchmark to see how they progress with treatment protocols is the best thing to do. So in the very initial state, it would really depend, right, on how severe they are. If they say, yeah, I'm having some sensitivity to light and sound and my headaches, I've only had 3 headaches in this whole month and I'm okay. So I'd be like, okay, let's start with right now, these lifestyle modifications. You need to increase your water intake, you need to go to sleep earlier. Oh, then I'm having trouble sleeping. So usually I'll be like, okay, let's start you on melatonin, mm-hmm. and it's okay to use mild anti-inflammatories for headaches because they don't seem that bad, but you seem to have some misalignment of your eyes. So we'll send you to vision therapy. So then if anybody has vestibular impairment or ocular impairment on our studies, which test convergence and balance and all that other stuff, then we have specialty therapy services that we can send people to, occupational therapy, even speech language therapy if their speech is affected. And then if they're really suffering with memory loss, even after a 3-month, intervention, then I'll send them to neuropsychology for testing and support. And, we also have memory occupational therapy to support them, and kind of continue out our prescription therapy support for migraines if they have that as well. My bottom line is if you let the disruption at the cellular level continue, meaning in form of headaches or dizziness or nausea, and not treat it in the short term, it just prolongs the recovery in most instances.
What are some of the integrative treatments that you use over time?
Yeah, so that is actually, there's a lot of things I can do and cannot do at a place that we have to follow a lot of evidence-based guidelines. So the evidence-based things that have been proven to help you after traumatic brain injury are omega-3 fatty acids, right? Up to 2 grams a day, because they're shown that these fats are already found in high quantity in the human brain. It's shown that these nutrients support you after traumatic brain injury to like lessen your symptoms. Mm-hmm. Another one that's a mineral that's really good for brain health or brain dysregulation is magnesium. We work them up slowly. We don't want them to have the milk of magnesia effect, which helps them with anxiety, sleep, as well as the feeling of calmness, after a traumatic brain injury. And then the basic support with, like, if you're already not eating on a balanced diet, like Mediterranean diet, you might just need a little more sleep, but I don't want you to cocoon yourself. We want you to still get exercise, lessen your stress. And really, again, I want to emphasize, for everyone, it's different, right? I work in a very type A sort of environment in New York, right? So everyone's very go-getter. They're like, oh, I can't take off work for 3 months. You must be out of your mind. I'm like, well, you either choose to work very little right now and not prolong your recovery, or, you can see how it goes and go back when you feel okay, but I think you'll prolong your recovery. And that's kind of what ends up happening until, they rev up their symptoms again, just because they don't take the proper rest and the medications or vitamins prescribed. And we kind of just go sort of seesaw a little until they're, okay, fine, I give up. Like, you were right, So it's a little of the stubbornness too, and not kind of believing, because it's a very conceptual thing. It's not something I can show them on an MRI. Like, look, you have a bleed here. You need to calm down. You know what I mean? More of a feeling and symptoms and things that are just very like, why is this happening to me? Another patient, came to me. She had a stack of papers like this, pretty high, and wanted to go through every single test and things that were done. And I took all the most important pieces of the information, and I said, look, we only have an hour for the first visit. I can't possibly go through all this stuff. We need to just focus on, what your physical exam says, why you're not healing, and move forward from there. And at the end, I made a recommendation that, look, her underlying anxiety itself was untreated, and her depression was never properly addressed. And as a result, she was really making herself kind of sick with worry on top of all her other symptoms. And I don't think she really liked that. She didn't think that I knew what I was talking about. But I think she gave it some thought, got actually on, some mood supporting like supplements first, and then decided to go on an antidepressant. And she, engaged in the therapy and got better like rapidly within 2 months, as opposed to she was going from doctor to doctor for 2 years.
Wow. Right. So that really speaks to your like N of one, that every patient is an individual that needs to be treated for their individual constitution, for where they are in their life, for what is the particular medical impediment for their health. And how do we use all of these tools to get a person from A to Z?
Right. And we really want to, my major goal would be, I wish I could just have a crystal ball or a magic wand and say, hey, you're just going to take these probiotics and you're not going to need anything else. Right. Maybe we're in a less stressful society that would keep us out of work for 6 months without asking us any questions, right? But people have to get back to their lives.
Yeah.
And you have to get them functional in order to take on all the responsibilities we have. That's our primary goal.
And so what are your thoughts about exercise? Because, often people with head injuries will have nausea or vomiting after their concussion. And so if they're capable of exercise, meaning like, it's not like they have a bleed and they've got a shunt in and they're inpatient, but like if they've had kind of this, I'm doing air quotes around like unseeable concussion, and they're getting nausea and vomiting or feeling nauseous with exercise, should they keep moving or should they stop moving?
Yeah, that's a very good question. If in the acute phase, it hasn't been that long, I always just say, just start with, first of all, don't sit in front of a computer for long periods of time. Give yourself, 10 minutes or 20 minutes on and then 20 minutes off, get blue light glasses and get as much fresh air as possible and just walk. Even if it's just walking, like do the bare minimum until you can graduate. And then that's a protocol that our physical therapist will take them through, is getting them balanced again. The nausea a lot of times comes from the imbalance of the eyes and the brain signal, like the signal between the ear and the eyes are all sort of messed up, and just getting them exposed to those triggers again and balancing them out again, in addition to making sure they're getting fresh oxygen and doing as much as they can without triggering themselves.
Mm-hmm. Like, should they be working their brains or should they be doing brain rest? Because for a long time it was recommended to like, don't think about anything challenging, don't do anything hard. But is that still the thinking?
So that has fallen out of favor with all of our new research. Basically, in the beginning, for the first week, we say take it easy, cognitive rest, meaning because we're in front of the computer all the time, and reading small letters, even books and stuff will give people headaches. It's fine to do that for the first week, but we try to get you back into society as soon as possible. That does not mean that you kind of do nothing forever and maybe like the first few days, but like then you kind of like graduate there, slowly.
So then the therapies and the supplements, and then there should be progress. Can you talk to us about a few stories of patients like who have been difficult to progress? Like, what do you do when it's like people don't seem like they're getting better?
Yeah, actually the good thing is that, we have a team of doctors, right? So usually it has to be a very like collaborative effort between a whole bunch of specialists. So now let's say somebody is 6 months out, they're still not getting better. And there are a lot of patients like that. One patient in particular, a young male, finds that he was just getting more aggressive and tired, and everything makes him dizzy and nauseous. Every medicine was making him constipated. Every vitamin he was having side effects to. So it's just, at that point, I kind of dug a little deeper and sent him, I did some minor workup and sent him for an endocrine workup. So, your HPA axis, your brain, your pituitary system is there. If you have a brain injury, that can be knocked out. And even small disruptions in testosterone or estrogen or this type of stuff can like hinder your progress. So once I got him to an endocrinologist and they started their workup and treatment and balancing a few things, some of the things that I was initially doing started clicking. So there are a lot of moving parts. Obviously, getting them into psychotherapy to regulate mood, as well as psychiatry. I mean, it's like I end up doing a lot of psych work because it's just so hard to get into our psychiatry colleagues.
Sure.
But we know that, the same receptors that are disrupted basically in the brain are disrupted in the gut, and there's leakiness, and it can throw off everything, and you might just need that minor support before you get over the hump. So, so neuroendocrinology is another big thing. Also, getting them into the right therapy, right? Vision, ocular, vestibular. And then, if the conventional measure is completely done, this is when we really need to call on our, evidence-based functional medicine type physicians, like, or practitioners of Ayurveda that know about basic things that may be kind of dysregulated, the heat, the vatas, the doshas, right? Acupuncture, biofeedback. There has been some research done on, glutamine IV infusions, as well as antioxidant therapy. So craniosacral therapy, all those things, I think. Then I'm like, you just need to now go for more of the holistic sort of traditional things to see, what you can tolerate outside of here. And then it really just takes them longer to get over it. But, then I'll see them back. And sometimes it just that they have to reset themselves to a new normal because they never get back to it.
We've had in our practice we've used a lot of Ayurveda for TBI, especially long-term TBI, people who have struggled for years. And one of the things we find is that the body always feels overwhelmed. It can never quite catch up with life. And so Ayurveda with the Abhyanga and Shirodhara with oil massage and the warm stream of oil on the forehead, sometimes that's a little too much early on. It's a little too activating. But often longer term, that finally gives the body like the deep rest that it needs so it can disengage from the external world and really do that internal reorganization. I think of it as like defragmenting the computer. We had a patient yesterday actually who came, or, this last week who came in with TBI who's been doing Ayurveda and said it has, over these last 8 months has been really helpful for her progress. So yeah. We've been pleased with that.
I'm definitely in agreement, that because it progresses at a slower pace and then traditional medical models, I feel, and it supports the deficiencies in the patient that may be there, as opposed to just trying to treat the symptom. You know? Yeah, so there have been a lot of functional medicine traumatic brain injury case studies. There's not been a multi-center study. This is why people are afraid to use these things like as commonplace. But with severe head injuries, including traumatic brain injury, there's a case study that was like published in Medical Acupuncture, like functional approach to traumatic brain injury in like 2017. And one case study, basically, it was a teenager involved in motor vehicle accident and with a poor GCS, but they used EPA, which is, EPA DHA is part of omega-3, and they use like very high doses, like 19,000 milligrams, fatty acids via his PEG tube, and high vitamin D. And then basically he was in the ICU for like 4 months with the high fatty acids and vitamin D. But after the initial stabilization, they saw improvement. Obviously, he still experienced speech and balance issues, but his improvement was faster than other people that would have had those severe injuries.
That low GCS, that Glasgow Coma Scale, is the one you're talking about, which goes from kind of, 0, 1, 2, 3, which is coma, up to 15, which is alert and oriented. So
right, exactly. And there are also so in addition to the fatty acids, there's glutamine that's used. I'm sure you know about that for gut health. It's very healing for inflammatory bowel diseases. And then there's research on progesterone able to help
interesting
female patients, especially. And when they were treating this patient, it doesn't tell me so much about why they actually chose progesterone for this patient. Did they test it and it was low? Probably not. But it has more to do with its glial cell and inflammatory cytokine type, like stabilizing effects,
Interesting.
They use vitamin D, progesterone, fatty acids, glutamine, and she basically stopped doing her like decerebrate posturing, which is like basically shows that cortically you're very, very damaged.
Wow, with little old supplements.
Yeah.
Little old vitamins. That's fantastic.
I think there's hyperbaric oxygen treatments that are used, a lot of times along with post-concussion syndrome, you have a lot of PTSD. So a lot of times I will be able to treat them with other things that are used for PTSD. I try to stay away from benzos as much as possible because of the addiction potential. Yeah, like, you want to make sure your good fats are up, like walnuts, omega-3s and avocado and things like that. So because our brain is mostly fat, you want a diet that supports the brain if possible. Like, definitely don't do a low-fat diet after a traumatic brain injury. Do a good high-fat diet.
Do you make recommendations in terms of like some of the traditionally thought of as more inflammatory foods like nightshades or meat or dairy? Do you have recommendations based on those?
You know what? I try to make it very simple because I think what you're saying about the nightshades, like tomato and all that stuff is and then even lentils, I think, with lectins and things like that just really gets into too advanced for a lot of my patients. Okay. Yeah. If they do ask, then I will. But what I generally say, just to make it as simple as possible, is like follow a Mediterranean diet.
Yeah.
As much as possible, fruits and vegetables, red wine, and they'll always smile, olive oils. Yeah. And in general, I'll just tell them like things like bread are inflammatory, like as much as possible. Like if we can get those out as much as possible,
like processed foods, like gummy bears.
Right. And just seeing how you feel after you eat something. So that's the best way to do it instead of following a fancy diet and, going to Whole Foods and spending $200. And then you're like, what do I do with all this? Because I don't know what to make,
Yes. Yeah. When you get a vegetable from a place you don't know and you don't know how to cook it and you're just looking at it going, how do I cut it? What parts do I eat? It's a big mystery.
Absolutely.
Let's loop back around a little bit to now that we've talked about all this stuff, those microglia and those astrocytes, just in light of kind of what we've talked about, can we revisit Like, what do those cells do and how do we impact them with our treatments?
Yeah, so you have to think that they are kind of like the brain scavengers or the brain sort of soldiers and trying to make sure that if there's a disruption, it's going to protect you. But what ends up happening in a lot of immune related things, because, after a traumatic injury, like you have autoimmune or immune like activation, of your brain and your gut, they hyperreact. They're like, oh my God, I'm here for you. And they just overreact and cause a lot of inflammation. And we have to get involved from the treatment aspect just to basically stabilize these cells, right? So if you want to talk about like the central nervous system, we have the brain immune cells, microglia, as well as astrocytes. They get activated after an injury. And then these microbe-derived neuroactive molecules and neural endocrine pathways then talk to the gut, right? And then the gut microbiota committee or communities will like increase their production, but they can only do that if you give them the proper foods, right? If you give probiotics or prebiotics. We've talked, recently more in the news about basically yogurt and, bananas and fruits and vegetables being prebiotics or certain fiber being prebiotics and making the good bacteria. And then these immune-derived molecules then allow these cellular functions to start repairing themselves, right? You have the gut immune cells, like the T cells and innate immune responses, basically go back to the brain and go, okay, here it is. Here are the healing cells. We're going to try to calm this inflammation down and this leakiness down. But definitely there's still a dysfunction. This is why everyone's feeling so crappy, I guess, lack of a better word.
So we have really covered the gamut today. We've talked about the central nervous system, the different parts, the different cells, the different relationships. We've talked about how the central nervous system communicates with the rest of the body, especially the gut, and how the guts can really seriously impact how the brain is doing in terms of mood and structure, function, and inflammation patterns and levels. And then we talked about traumatic brain injury, both mild mTBI and traumatic brain injury, that the first thing, of course, the first assessment that is required is there a bleed in the brain? Because that's a whole medical emergency. That if you're listening to this podcast and you're wondering if you have a brain bleed, that's, you got to go in. You got to go in and get imaging. But once we've ruled that out or addressed that, then we're really looking at the months afterwards, really the acute period, the things that we can do for ourselves in the acute period with the omegas, magnesium, and then the things that we can do longer term. Even progesterone for women and our hyperbaric oxygen therapies. Are you familiar? Do you know anything about ozone, IV ozone?
I actually have heard of it, but I'm not familiar with it specifically for TBI, but I would be happy to learn.
Okay. I'm just curious. We do use it in our clinic for a lot of chronic illness and especially in terms of supporting mitochondria to kind of regroup and regain and rebuild. And so, of course, that's necessary in extended TBI, even acute TBI, we use it. But I know it's not a very conventional therapy, so it's not typically done. But we've talked about all the different things, including exercise and mental health. Is there anything else that you would like to talk about with traumatic brain injury and brain health?
Yeah, I think number one thing is setting expectations for yourself, right? If you have to be patient with yourself, you have to work with a physician or person that's been trained in traumatic brain injury, because there are a lot of pop-up shops claiming to know everything about concussion. So you have to be careful and do your research and basically go to some, because, and again, not all neurologists are also trained in traumatic brain injury. They kind of know what to do with you in the ICU or if you come in with a stroke or whatever, but then when you're like out, it's just the fallout and these type of lifestyle stuff is better managed with someone who has the knowledge how to manage the mild traumatic brain injury. The other thing is, there are a lot of alternative treatments we talked about, that also you have to be under the care of someone to make sure you're not overdosing on even common vitamins. Certain things can be toxic, especially fat soluble vitamins like vitamin D and E. So you have to do your levels, make sure you're not going overboard. Another thing I want to mention is like choline, right? That's anti-inflammatory and antioxidant. Basically, that helps. That's what makes up the cellular lipid bilayer of lots of brain cells. So supplemental with choline, or it's naturally in a lot of foods like eggs. Creatine has shown it could improve basically cognition and behavior. during the initial acute phase of TBI. Curcumin, everybody loves turmeric, right? It's curcumin's the active form in turmeric. It's some evidence of improved motor and learning performance, cognition, and reduced cerebral edema in like animal models. Then there's been a lot of talk with glutathione, right? Glutathione, basically, we were just talking about ozone therapy, how it reduces reactive, basically oxygen sort of species. We want to decrease the fallout from the inflammation, which is then basically what damages the cells around it, right? We have talked also in research a lot about ketogenic diet, or things like seizures and in general, even in Alzheimer's and brain health. Lipoic acid, we also talked about magnesium, melatonin, for sleep regulation, all the fat-soluble vitamins, because the brain is mostly fat, right? Also zinc, basically, zinc shows positive effects in severe closed head injuries. We talked about progesterone, and it's a steroid hormone, but it has neuroprotective effects on injured brain cells. So that's actually all in a nutshell. But you definitely need to be under the care of someone who understands and can see which one you would benefit from.
One point we really should not miss making here is that concussions can be cumulative, right?
Yes, definitely.
So that if you have one, then it's really important not to get another, and especially not to get another too soon.
Right. So when we call it, like, sometimes you can have subconcussive hits if you go back too early, but the more concussions you have, and it all depends on how young you were, what was your baseline function at that time, did you properly heal, or did you just keep going back in the game and giving yourself more and more injuries, right? We have some challenges, especially with sports, young people in sports who are trying to achieve and get to the collegiate level and then to the pro level, of trying to hide their injuries. And you really have to think about it in a longer term fashion. And to the sports, I guess, organization credits, there's a lot of new adjustments, done in no head-on tackle and heading the ball in soccer and things like that, and certain things in hockey as well to try to protect the player. But you also have to understand that this is the rest of your life. Like, you're not going to be playing football or field hockey when you're 50 or 60 or 70 when you want to have some quality of life.
That can get into, especially in the pro levels, the CTE, the chronic traumatic encephalopathy. Is that right?
Yeah. It's a very hot topic for people. Basically, it's a pathological diagnosis. So you should never go trust anyone who gives you a diagnosis of CTE, because unless they harvest your brain and take the brain cells and put it under a microscope, they cannot make a diagnosis. They can make a functional diagnosis by saying, okay, a lot of your symptoms line up, like memory loss, mood dysregulation, or anger issues, or constant headaches, or so those type of things over the long term can accumulate and say you probably have longer term damage, and then can be supported by like fMRI or like targeted neuropsychological testing. But in general, this is a pathological diagnosis made only after someone passes away.
And one last intervention, this was kind of going to be a TBI month for our podcast, because our next show is going to be Kyla Pierce, who is representing the Love Your Brain Foundation and the Love Your Brain 6-week yoga intervention for TBI. So yoga, the traditional word yoga is a Sanskrit for unite, for bringing the body and the mind together. And that's one way to really address TBI and address head injuries, is by healing your body through your mind and healing your mind through your body. So by uniting them, we have a stronger, we can make an ally out of our own system.
That's amazing. And I know you mentioned that briefly, and I would love an introduction to your next speaker. I think we are aligned in a lot of the things that we try to help people with, but I would be very interested to see how they've come up with this type of protocol, especially because there's a lot of patients that have problems with balance. And you need a certain amount of balance in yoga. So perhaps they work on the balance, first strengthening that and then going into the poses. So
yes, absolutely. Yeah, I'm happy to do that introduction. That's what this world is all about, is bringing each other together so that, we're just stronger together. So I'd be honored. Yeah.
That's amazing. Yeah. I just really love to be part of what you're doing here, bringing all of this really good information to people. Now we're in a sort of a very sort of like information overload age.
Yeah,
absolutely. We need to kind of boil it down to the experts and people who've actually studied things, as opposed to put just videos on TikTok and try to be, the self-proclaimed experts about things, to dispel myths and try to set people straight, about questions that they have.
Absolutely. And that's why we have you on, Shae. So we are so happy and so honored to have you here. Just going back to your bio, the things you've done and the things are just incredible. And thank you so much for sharing everything with us today.
It was my pleasure. Thank you for having me.
Absolutely. And thank you to our listeners for listening in today with Dr. Shae Datta. We've got lots of ways to continue this conversation through Facebook, Instagram, and Twitter. You can get more information from us and about us at our website, centerforhealingneurology.com. And you can find Dr. Datta at her clinic at NYU Langone Hospital in Long Island, which is New York. Please be sure to share this show with your friends. We welcome your rating and review wherever you get your podcasts, and feel free to send topic requests to podcast@centerforhealingneurology.com. We love that you've joined us today to discuss how to make our whole world medicine. We rise or fall together, and we're committed to doing what we can to make as many of us as healthy as possible. And this takes all of us, including you. Thank you for listening, and see you next time.
Partyfish Media.
Partyfish Media acknowledges that it operates and records on indigenous Duwamish and Puget Sound Coast Salish land that is still home to the Duwamish tribe. This land is stolen in violation of the Point Elliott Treaty of 1855. We are committed to uplifting the name of these lands and community members from these nations who reside alongside us. For more information on this land, its people, or ways you can help, visit duwamishtribe.org or realrentduwamish.org.